So welcome everyone. My name is Raffaella Melilli and I am a fifth-year medical student at the University of Exeter. Today I will deliver a webinar series on the health effects of climate change, and this was developed as part of the Medics.Academy virtual elective. So why is it important to know about climate change? Now, climate change is a global challenge that can have massive implications for global health. And we have learned from COVID that environmental factors can have huge implications on health and society. So awareness of climate change and its health effects is important for medical students and doctors in order to be better prepared to face some of the global challenges of the future. So this webinar series is divided in three parts. In part one, we will cover an introduction to climate change and the health consequences of the warming climate. In part two, we will cover the health consequences of air pollution and infectious diseases. And finally, in part three, we will cover the nutritional changes and some principles of climate change policies. So for now, we will focus on part one. So some key facts to get started. The overall health effects of climate change are overwhelmingly negative. Climate change tends to affect the social and environmental determinants of health. So for example, the quality of air, access to safe drinking water, food security, and shelter. It is estimated that climate change will cause 250,000 deaths per year between 2030 and 2050 from things such as malnutrition, malaria, diarrhea, and heat stress. And the areas with weak health infrastructures, so mostly developing countries, will be the less able to cope with these changes without any assistance. So finally, reducing emissions of greenhouse gases through better transport, food, and energy use choices results in benefits not only for the environment, but also in improved health, as we will see. So when we think about climate change, there are four main primary elements that cause the health effects we see. These include higher temperatures, higher atmospheric CO2, sea level rise, and floods and droughts. And this can cause direct health effects or exacerbate existing medical problems. So when we talk about global warming, we are talking about the global average temperature. And this has increased by approximately 1 degree Celsius since the end of the 19th century. And it is likely to increase by at least 2 degrees Celsius by the end of this century. And one key thing to notice is that when global temperature rises, this does not happen equally everywhere. So places like the northern parts of the planet, as well as parts of Brazil and Australia, are warming many times faster than the tropics. The underlying process that drives global warming is the greenhouse effect. So this means that there are gases in the atmosphere which trap heat, and in so doing, they allow the heat energy coming from the sun to not be lost in space, but to remain in the atmosphere. And this is what makes the climate on the planet what it is. Some of the most important greenhouse gases are carbon dioxide, methane, and nitrous oxide. And CO2 among all of these is the most common greenhouse gas by volume. We know there is a strong correlation between CO2 and temperature because of the greenhouse effect. And as CO2 increases, temperature also increases. So we also know that increases in CO2 levels have been associated with increases in global average temperature, leading to a climatic shift towards hotter weather and more recurrence of hot weather. And this occurs because as concentrations of CO2 and other greenhouse gases increase in the atmosphere, because of the greenhouse effect, the amount of solar radiation that gets trapped also increases. And then there is an increase in global temperature. So it makes sense to expect that adding greenhouse gases into the atmosphere in the future will warm the planet even more. There are several factors contributing to the overall surface temperature, and you can see from this plot that greenhouse gas derived from human activities is the main contributor to global warming, while other factors are substantially negligible. And most of CO2 emissions are generated by burning fossil fuels, such as coal, natural gas, and oil. As for sea level rise, there has already been a rise of 90 millimeters since the early 1990s. And it is expected that the rise will be at least 1 meter and perhaps 2 meters by the end of the century. And this is relevant because 1/3 of the world's population, so that's about 2.4 billion people, lives on a coastal region, and many of the world's largest cities are located on the coast. The two main causes of sea level rise are melting of land ice, firstly, particularly in Greenland and Antarctica, and secondly, thermal water expansion. Thermal expansion of water happens because more than 90% of the atmospheric heat is absorbed in the ocean, and as water warms, it tends to expand. So again, one important thing to notice here is that rates of sea level rise is not homogeneous, is not a homogeneous process, and some places are more affected than others. As global temperatures increase, there is also an increase in extreme weather events, both in terms of intensity and frequency. And this is because warmer air holds more water, and where that air with more moisture is ready to rain, it rains in greater amounts, potentially leading to floods and natural disasters. At the same time, warmer temperatures also cause more evaporation and drying of land, leading to desertification. So this may seem contradictory, but once again, this process is not uniform across the globe, and places that already tend to get more precipitations will get even more, tending towards floods, while places that tend to get less precipitations will get even less, tending towards droughts. So climate models suggest that rainfalls will become more intense in places like North America, Europe, and Asia. So the take-home messages so far are the 4 primary drivers that from climate change lead to health outcomes are warmer temperatures, greenhouse gases emissions, sea level rise, and extreme weather events. The largest contributor to climate change is emission of greenhouse gases from human sources, and all the climate processes we have seen are not spread homogeneously across the globe. So now we will start looking into the health outcomes of climate change in detail. And when thinking about health outcomes of climate change, it is useful to divide them in 4 groups. And this classification is not exhaustive by all means, but includes the main outcomes we'll talk about. So the first group includes health outcomes of heat, such as heat-related illness. The second group includes health outcomes associated with air pollution. The third group includes infectious diseases, which are driven by things such as rising temperatures, precipitations, and biodiversity loss. And the fourth group includes the nutritional outcomes resulting from changes in crops and fishing products. So in this first part of the webinar series, we will cover the health outcomes of increased heat. So let's start with heat and health. The amount of global population exposed to heat is increasing due to climate change, and the temperatures are increasing in frequency, intensity, and duration. So it is estimated that between the 2000 and 2016, the number of people exposed to heat waves increased by 125 million. And we know that heat waves are associated with increased mortality. If there is no substantial move from fossil fuels and the planet warms by 4 degrees Celsius in the worst case scenario, 3/4 of all people will experience lethal heat waves by the end of the century. And as global temperatures continue to increase, more people will be affected by health consequences associated with extreme heat. The heat exposure pyramid shows a range of health effects caused by heat exposure and the proportion of population that may be affected. So the wider the pyramid is at each level, the more people are likely to be affected by that specific health effect. So starting from the base, most people may experience mild symptoms such as sunburns, heat rash, heat cramps. Heat also makes it harder to think, and it is shown to decrease productivity, reducing work capacity and labor productivity. And this may be significant in developing areas of the world. Going up, there will be a proportion of the population with pre-existing disease made worse by heat, particularly heart failure, diabetes, lung disease, and renal disease. And this is because heat can promote dehydration, which can make all of these diseases worse. But also heat causes direct stress to organs such as heart and lungs, and so they start working less effectively. And then also higher temperatures raise levels of ozone and air pollution, and this further exacerbates cardiovascular and respiratory disease. As we go up, other heat-related illnesses can occur, such as heat exhaustion, heat stroke, and this can ultimately lead to death. And although death from heat is rare, these conditions are dangerous and need to be taken seriously. So as global temperatures rise, it is expected that there will be an increased incidence of heat-related consequences in certain areas. And in those areas where there is already an exposure to these effects, they may experience them with more frequency and in more severe forms. Everyone is potentially vulnerable to heat. However, this is most dangerous for certain groups, including people who live in tropical regions, outdoor workers such as farm workers, construction workers, fishers, because all of these people suffer from a substantial burden from day-to-day temperature increases, as well as the poor, displaced, and homeless. Then the extreme of age, so children and the elderly, because they have a less ability to dissipate heat effectively. And finally, people with pre-existing disease, as we have already seen. So we have discussed heat-related illnesses and exacerbation of chronic diseases, which can lead to accelerated death and increased mortality. But there are other effects of extreme heat that is worth mentioning. One of these is the hospitalizations that can occur from respiratory disease, diabetes, renal disease, stroke, and mental health conditions. And also the impact on healthcare services as extreme heat increases, because usually this is associated with increased ambulance call-outs, slower response times, more people seeking care in emergency departments, and increased number of hospital admissions. So the scale and nature of the health impacts of heat depends on the timing, intensity, duration of a temperature event, as well as the level of acclimatization, the adaptability of the local population, the infrastructure and institutions to the prevailing climate. So you can see that the picture is very complex and predictions are difficult to make. So this is the end of part 1 of this webinar series, and thank you for listening. And make sure you check out part 2 of the series, which you can find below in the description of this video.